we talk about patient behavior. We are already thinking about bruxism. And look how interesting. The patient noted down date, start of the problem, 2015. He can report how long he has been experiencing tooth wear and jaw pain. Guys, the patient sometimes suffers for 10 years, almost 10 years of suffering. And he reports that he notices the wear while sleeping. And what happened to him during these 10 years? Nothing, because he didn't find a dentist to delve into bruxism with him. So let's update ourselves in this post-pandemic moment in history where the patient has changed. This is the diagnostic plate exam. It's an entirely red plate. It was red on the first day, and this ink doesn't come off with water, only with friction, okay? I published this in 2019. Since then, I have been doing it on all of my patients. Just as we need an x-ray, we need a diagnostic plate exam to know what the patient does at night. Remember, your patient is sleeping poorly and you don't know it. You don't know what he does with your restoration, with your root canal, with your implant when he sleeps. And here is the result. This is what he does with your restoration, with your root canal, with your implant when he sleeps. And this is super important for you to provide continuity, longevity, or guarantee of any dental treatment. Because if the patient does this during the night, you cannot guarantee, for example, the implant for years. You cannot provide a guarantee. You need to note it down. You need to make it clear that this patient makes this nocturnal movement. And then, yes, proceed to the treatment that I will teach during the advanced dentistry week. So the patient makes a lot of movement, you see. He was removing all the ink from the plate, showing that he does with repetitive and rhythmic movements to remove all this red ink content. So you will not stop your endodontic treatment. You will do your endodontic treatment plus the diagnostic plate examination plus the bruxism treatment to ensure that this patient improves both their quality of life and the longevity of dental treatments. So if you want to know more about these topics, start following me and share with more dentists.